is that the normal physiology or the workings of the kidneys is that they filter waste and excess fluid from your blood. And then from that, you urinate out the waste and the excess fluid, right? Okay, so chronic kidney disease, which basically means long-term or over time, is gradual loss of the kidney function. So your kidney is no longer able to filter that waste and excess fluid. And then when that happens, buildup happens. So dangerous levels of fluid, electrolytes, and waste build up in your body. So that's not a good thing, right? Okay. All right, so what causes kidney disease? As we mentioned earlier, as Dr. Renfro mentioned, hypertension, so high blood pressure. Diabetes, as Mr. Baker mentioned. And then we have medications, either prescribed or over-the-counter, such as ibuprofens, aspirins. They can also have effect on kidney disease or cause kidney disease. Then you have drug abuse as well. So like they mentioned before, the IV drug use, even crack, cocaine, things like that, those can lead to kidney disease. And then intentional overdoses and autoimmune diseases. So autoimmune disease kind of is basically like when the body is essentially attacking itself. So yes. And then, okay, so kidney disease also another one of the silent killers. So there's very subtle presentation, so meaning that it's going to be very, you might not recognize it. Again, like we mentioned before, you may be going through life feeling fine, but that's why it's so important to go to your doctor and make sure that you get all the exams, all of the scans, everything that you need to do so that they can diagnose and treat whatever condition you might be having. Early on, you might have no symptoms, as I mentioned before. You may experience nausea and vomiting, fatigue, or like excessive tiredness, and then decreased appetite. And you might either be urinating more frequently or less frequently. So sometimes you think that it's just one. It could be both. So if you're seeing yourself urinating way more than what you're drinking, or if you're urinating way less than what you're drinking, you need to go and see the doctor. Okay, and then also swelling and dry and itchy skin. Okay, so dialysis. So does everyone know basically what dialysis is, or at least know someone on dialysis? I'm pretty sure we all do. I have a couple of family members on dialysis. So you start dialysis when your kidneys no longer function. So when they can no longer filter out the waste products and no longer filter out that the excess fluids, that's when you need to start dialysis. There's such things as at-home dialysis, so they will come to your home and you'll have a dialysis nurse that will come in and give you your dialysis treatments, or you have the clinic-based dialysis, meaning that you go in about 3 times per week. I'm sure we've all seen the dialysis clinics kind of all through it, and if you would notice, they're prevalent in our community specifically. There's a lot of them, especially in this area, third world area, they're everywhere, because it's prevalent in our community. So, but the risks of dialysis is infections, strokes, as mentioned before, heart failure, liver failure, and the need for transplant. So the best thing to do is probably to prevent yourself from having to have dialysis, which means you're preventing kidney disease, which means you're living a healthy lifestyle. It kind of all flows in and connects in that way. So speaking on prevention and next steps, what's most important, as everyone mentioned before, your annual doctor's visits. I know it can be sometimes a hassle or an annoyance to go to the doctor or schedule those appointments when you have other things to do. But in order to keep doing the things that you want to do, you need to go to the doctor so that they can help you keep living so you can do the things that you want to do. Also, diet and exercise, very important, as everyone mentioned before. We should be walking. I even was guilty myself from being in school. I was like, oh, exercise got put on the back burner for me because it was just so much stress and studying and everything. But I recently started walking an hour per day. I'm trying to get 10,000 steps in per day just so that I can just live a more active lifestyle. I've always drank a lot of water, but just if I'm drinking a lot of water and eating crawfish every other day, that's not the best thing for me, right? So I'm like, let me get moving, let me get drinking my water, and just doing as much as I can to stay here as long as I can, because my grandmother is 99 and I'm trying to match that. Also, you take your necessary medications, meaning your medications that are prescribed to you, not the ones that you get from your friends, not the ones that you find, none of those. You take the ones that are prescribed to you by your physician. And also pain meds, you take them as needed. My mom is guilty, I know she would not have an issue with me saying this, mom is guilty of taking a BC powder almost every day for her knees. You know, she's like, oh, and like y'all mentioned before, I heard someone say earlier, because it works. I get it, but there's certain things that you can do to offset that pain and not have to take medication every single day. Okay? And then also, you know, I'm a nursing student. I'm not a graduate yet, so if y'all do have any other questions, I can do my best to answer, but I'll also ask my panel as well. Any questions? Yes, sir.
I have one question about kidney failure and signs of it. When a person stays congested all the time, it's just blowing their nose constantly. Every time you look around, and you always see them drinking fluids. I was just wondering, is that a sign of something going on with your kidneys? You're not going to the restroom a lot, but it's
like
coming out of other areas.
Congestion, like
blowing
their nose a lot?
Yeah, a lot. And don't have a cold.
So that's a good question. You want me to?
Yeah.
Okay. So that's a good question. That's a loaded question, mainly because it could be a sign that you could have a multitude of problems. Like we mentioned, diabetes makes you what we call a little immunocompromised, meaning you never really clear some infections. So maybe like a normal sinus infection that a regular person should clear in a week, maybe you're not clearing those infections because you have diabetes or because you have kidney disease and you're not clearing those toxins out of your body. So it could in a way be tied, but it's not necessarily a symptom of kidney disease specifically. But that person, I would tell you to tell that person that they should see someone, because it could be a sign that something else is being missed, and that's the way in which it's presenting.
Yeah, that's why I brought that up, because I'm thinking the doctors are missing something. I saw my mother go through that. I mean, it got so bad that it was just draining out of her nose. My mom, when they first put her on dialysis, when they first tapped her, they took 150 pounds of fluid off of her body.
Wow.
Yeah,
That's a lot.
150 pounds of fluid.
Wow.
And after that, she had to have it
Really? Yeah.
regularly,
Yeah,
3
it could
times
be.
a week. And didn't want to do it, but
Yeah.
Compliance is definitely important.
a period of time that it did. And I noticed her at first, she just blowing her nose a lot.
Yeah, there's a lot of, she
And
got
that thing
fluid
was
on her.
Yeah.
Yeah.
Her kidneys.
Yeah.
Kidneys was gone. So-
Any other questions from anyone? Yes.
So, GFR, growth EGFR,
Glomerular
fluctuates, say it's been as low as 11,
Okay.
but the baseline, and this is from the nephrologist, is 18. Can I get that over to 20 so I can be out there? This is me. Out of that transplant zone.
I'll be honest with you, it would be very challenging. The thing is that some things in our body regenerate, right? Like you cut your skin and it grows back, right? But some things don't. And so the kidneys over time, as they get more and more damaged, it's harder for them to filter out the toxins. So eventually that GFR, the glomerular filtration rate that you're speaking of, is a reflection of how well your kidneys are filtering. So though it can improve, definitely with weight loss, with eating better, it can improve. The kidneys do not regrow. They do not regenerate completely. And this is why this topic, like everything that we've mentioned up until this point, even what Irvin said, that about the kidneys leading to high blood pressure is one of the things that people don't realize is that you can have underlying kidney disease that you're not aware of, and then they just diagnose you with hypertension, put you on medications, don't check your kidneys, and then 5 years later, you're in renal kidney failure. And it was unclear. They thought, oh, just lose weight. It's about your weight, and and it's not. We see some very healthy, fit men who have high blood pressure, and it doesn't make sense. And that's why he said, make sure you get those kidney ultrasounds, because it could be that you have high blood pressure because you actually have kidney disease. And I know he won't mind me sharing this. You all know Brian, our cousin, he was taking it's called NSAIDs, ibuprofen, over-the-counter medications regularly. Joint pain, athlete his whole life, pain, always in pain, taking these day to day, that causes kidney disease. So that's why Alex mentioned, do not take over-the-counter pain meds on a regular basis if you can avoid it, because that is getting filtered by your kidneys every day. Every time you take a pill, it's going through your kidneys. And eventually that can cause the kidney disease, which can cause the high blood pressure, which can then put you in a spiral. Because once you're on dialysis, you're on dialysis. There's really, the kidneys are shot. And so you're not there yet, so there is hope there. There is hope there. I can't say that it'll go back to normal, but I do think that if you really pay attention to the diet and the exercise and all the things we discussed today, you can at least get into a better place. I believe that that's possible, but you're not all the way there. But once you're on dialysis, you're on dialysis. And that's why we say this, we want you to be aware.
Yeah. Prevention is everything. Yes, sir?
After your lung has collapsed, let's say both your lung had collapsed after your accident, do your lung reinflate?
After a chest tube.
Huh?
After a chest tube.
Because I had one, but okay, thank you.
It can. It depends on the why, but yeah, it can.
You need a chest tube.
I know it's unrelated to what's going on here, but it also depends on the extent of your collapsed lung, right? If it's super collapsed, you might need like a chest tube, right, to get out the air that's keeping it collapsed, right? But if it's like a smaller collapsed lung, then a little bit of oxygen in the hospital setting, it'll slowly begin to reinflate.
I was in a head-on collision in 2010, and a lady died in the opposite car. Her grandson leg was broke. I was placed in a coma, and the person who was driving my car left me for dead. So, with that being said, I was in a coma, and all that. They said when I woke up out the coma, I started snatching all the stuff that was hooked up to me, and they said I caught my stroke right then and there. As soon as I started snatching out the stuff, they said that's when my stroke hit me. They said I had 2 strokes back to back. And it's all good. I mean, I know I'm walking testimony. I know God is good. Yes. But my point is, I just want to know, did that reinflate?
Yeah,
I was just wondering.
You're breathing good.
Any other questions?
Any other questions?
Mm-hmm.
All right.